Good morning, Chair Postman, Member Garrett, staff and guests. The lobbies are open and the recording has begun.
Thanks, Gretchen. Good morning, everybody. We'll convene the board caucus meeting for Tuesday, September 24th, 2024. Member Vollendroff had a conflict and is on leave today. Our first item up is a discussion about a research study on bud tender training, which I'm really looking forward to, but I'm going to just turn it over to our research director, Sarah Oakey, to introduce our guest.
Hello, Chair Postman and Member Garrett. I hope you are doing well. I will do a quick introduction for Dr. Cassidy Laparco and provide some context and level setting for this presentation, and then I'll hand it off. So Dr. Laparco is a postdoctoral research fellow in the Milken Institute of Public Health at George Washington University. She has research expertise related to preventing and reducing harm associated with a variety of different substances. For example, she has published many articles related to online and in-store retail availability, risk perceptions, and marketing and exposure for both regulated and unregulated substances, such as cannabis, delta-8 THC, kratom, alcohol, and tobacco. Dr. Laparco is really at the forefront of a lot of this research, and it is such an honor to have you here today presenting. Dr. Laparco is also a presenter at the RSMJ Conference Symposium that Kristen Haley and I were a part of and chaired earlier this summer. So today, Dr. Laparco will be presenting on one of her many recent publications. This is a peer-reviewed published manuscript entitled State Requirements for Non-Medical U.S. Cannabis Retail Personnel. I have asked her to present this particular research given recent discussions that stem from the DOH and LCB Cannabis Consumer Collaboration Survey. And as a reminder to the audience that we presented on that project on June 4th of this year. So if anybody wants to review that presentation, that's online. And we also have materials posted online at the research program's webpage. So in that survey, we found that cannabis users and retail employees were interested in learning more about cannabis. Retail employees were particularly interested in learning more about what the labels of cannabis packaging mean and state cannabis laws. Similar to prior research, we also found that cannabis consumers ask bud tenders many questions and rely on them to provide information such as health effects of cannabis and what to purchase. When we presented this a few months ago, there was discussion about the role of a bud tender, requirements to be a bud tender, and potential training opportunities. And there were also questions around what other states are currently doing. So this research that Dr. Laparco will be presenting on will help us answer that question about what other states are doing and get a better sense of landscape across the United States related to bud tender training. So Dr. Laparco, thank you so much for being here, and I will turn it over to you.
Awesome, thank you so much. Let me go ahead and share my screen. Okay, can you guys see everything okay?
Yep.
Okay, awesome. So thank you for allowing me this opportunity to present. Like Sarah said, the presentation is titled State Requirements for Non-Medical Cannabis Retail Personnel, and recent publication in the Journal of Public Health Management and Practice. So just a little bit of background information. Cannabis is the most commonly used federally illicit drug in the US, with 15.9% of adults reporting past month use in 2022. As of August 2024, 24 states have legalized recreational cannabis, and this number is expected to continue to grow. Cannabis retail personnel, also known as bud tenders, play a key role in regulatory compliance, such as maintaining required signage in retail settings. Like Sarah mentioned, bud tenders are sources of cannabis-related information to consumers. They often provide recommendations about which products will achieve certain desired effects, despite health claims being illegal in certain states. However, some do fail to provide information regarding possible adverse effects, asserting that consumers should evaluate these effects for themselves. These recommendations likely impact consumers' cannabis perceptions and purchasing and use behaviors. Despite the pivotal role of bud tenders in ensuring regulatory compliance and educating consumers, there is a notable gap in research focusing on bud tender requirements. Previous studies conducted in 2015 and 2016 indicated that only about half of the bud tenders received any formal training, and in qualitative research, bud tenders endorsed the need for certain information, particularly related to regulatory compliance. To address this gap, the study that I'll be presenting today assessed state requirements for bud tenders working in states with active non-medical cannabis markets. So in August and September 2023, we examined bud tender requirements among the 20 states that had active non-medical cannabis markets. 2 coders reviewed state laws related to bud tender requirements from government and licensing board websites in each state and summarized key requirements to be coded, which included minimum age requirements, application fees, background check and fingerprinting requirements, conviction-related implications for employment, and required trainings. The coders then independently extracted data from state government and licensing board websites, compared findings, and discussed reasons for discordant data, and reached final consensus. 85% of states required bud tenders to be at least 21 years or older. The other 15% only required bud tenders to be 18. 13 states required bud tender application fees ranging from a one-time fee in New Jersey of $25 to a recurring fee in Arizona of $300 every 2 years. States that did not have an application fee included California, Maryland, Michigan, New Mexico, New York, Rhode Island, and Washington State. Fingerprinting was required in 12 of the 20 states. 80% of the states required prospective bud tenders to undergo a background check. And Missouri, New Mexico, New York, and Washington did not require any background checks. And among the 16 states that did require background checks, 10 provided lists of felony convictions or delinquencies that would prevent employment, with the type of conviction and the date of occurrence being state-specific. In 5 states, felony convictions did not automatically exclude participants. The Department for Cannabis Control could determine eligibility based on a variety of factors such as circumstances of the offense or rehabilitation. Maryland can reject applicants based on unspecified quote-unquote substantial reasons, and Oregon can reject applications based on quote-unquote reputation and moral character. Applicants who were denied were allowed to request hearings or petition in California and Massachusetts. Some form of training was required in 7 states, including Alaska, Illinois, Maryland, Massachusetts, Montana, New Jersey, and Oregon, although direct links to the training websites were not always available. The nature of the trainings varied in terms of the cost, content, timing, frequency, and testing. In Alaska and Montana, bud tenders were required to complete a state-approved training course. Illinois, Maryland, and Massachusetts required bud tenders to take a responsible vendor training course annually. And additionally, Illinois, Massachusetts, and New Jersey required bud tenders to complete 8 hours of training annually. Maryland, Massachusetts, Montana, and Oregon were the only states that required bud tenders to take and pass a permit test, requiring a minimum score of 70% for Maryland, Massachusetts, and Oregon, and 80% for Montana. Fees related to the required trainings were only found in Alaska, which ranged from $10 to $50, and Illinois, which ranged from $64 to $175. Although state trainings were not required in Michigan, Missouri, Nevada, New York, or Vermont, cannabis retailers were required to train employees according to an employee manual, which must contain information related to cannabis safety, use, access, and verifying age and identification. So to date, this is the most comprehensive assessment of state requirements for bud tenders working in non-medical establishments. 3 states required bud tenders to only be 18 years old, despite the legal minimum purchase age of 21. Only 7 states required training, and few state cannabis licensing board websites actually provided information on what the trainings entailed or provided links to official trainings. As such, the quality of these trainings and which trainings actually earned state sanctioned certifications was unclear. Trainings varied in cost, length, whether and how knowledge acquisition was assessed, and the number of testing attempts allowed. Future studies should assess whether training increases bud tender knowledge, regulatory compliance, or effective consumer education. 13 states had application fees, with some over $100 and requiring annual renewal. 16 states required background checks, with 12 also requiring fingerprinting, sometimes annually, which may involve additional costs to applicants. Oops. Sorry about that. More than half of the states requiring background checks specified that a felony conviction would prevent employment. States with older, active, non-medical cannabis markets, such as Washington, had almost no requirements. In contrast, most states that legalized non-medical cannabis more recently required trainings, had no application fees, and did not require background checks. Future research should compare required fees, conviction-related exclusions, and other bud tender requirements to requirements for other positions that handle substances that may be misused or restricted to adults, such as bartenders or methadone treatment facilities. Findings have implications for equitable employment. Application fees and related expenses may hinder the ability of those from low socioeconomic status backgrounds to apply. While there is rationale for some felony-related exclusions for employment in the cannabis industry, such exclusions may decrease employment opportunities for disadvantaged populations. Another study indicated that bud tenders who had versus had not received training were more likely to identify as white or Hispanic versus Black or another race, and were less likely to have health insurance. Unfortunately, these implications contradict the spirit of equity-related policies in some states. For example, policies that provide specific pathways or priority licensing for underrepresented populations, or expunging drug-related criminal records. On the other hand, allowing individuals who have cannabis-related felony convictions to serve as bud tenders may facilitate equity-related goals. However, careful consideration may be needed regarding the nature and severity of convictions and whether particular oversight is needed for bud tenders with such prior convictions. The current study is limited by its focus on state laws, excluding local jurisdiction regulations or retailer-specific requirements. However, these findings do provide crucial insights into the intersection of public health and social justice. It's imperative for policymakers to enact regulations that mandate evidence-based trainings for bud tenders and address potential inequities related to cannabis, particularly related to equitable employment opportunities. And here again is just the citation if you guys want to read the full paper, as well as my contact information.
Thank you so much.
Great.
I have a few questions, but I'll
No.
give it to Chair Postman and
No.
Member Garrett.
I'm okay if you start. I think
Okay.
member is, yeah, that's great. Go ahead.
So one of the discussions that we've recently had is related to optional training. If retailers are interested in receiving education, then maybe mandates aren't necessary. Because if we provide them, people will want to take them. Did you see any states that provided any like state endorsed training or optional training on their websites without it being kind of that mandated route?
So we did not see that. That doesn't mean it doesn't exist. It just means it wasn't on the state, website. It may be just that individual retail establishments have that kind of information, but it wasn't like on the government websites.
Well, and it was also interesting to me that a lot of the state websites didn't contain a lot of like meat about what the trainings did provide. Um, do you have any thoughts on what would make a training to be high quality?
So there's a variety of factors. So sometimes the syllabus was available. This wasn't in a lot of the cases, but there was like, how to talk to consumers, what you're allowed to say about consumers, general information about what the different state requirements are for like regulations on testing, labeling, things like that. I think the biggest thing is like testing. A lot of them, if they did require tests, it was kind of like an unlimited number of attempts and things like that. I know in certain situations, group learning works. And so you can kind of do these interactions with where you pretend to be a consumer and ask certain questions. Yeah, I think it's really just trying to be comprehensive.
Great, thank you. And then one last question from me. Uh, so in Washington, DOH is currently working on the mandated optional bud tender training for high THC. And I know your research expands a variety of different THC, including Delta 8 or hemp-derived products. And I'm curious if when we're thinking about training for in Washington, like I-502 retail cannabis employees, whether it'd be beneficial to include some type of training, and who knows if the research is there yet, but evidence-based training comparing and contrasting like different types of THC, like Delta 8 or Delta 9.
Yeah, I think that's probably one of the biggest questions that consumers will have in these shops, what the differences are. Again, like you mentioned, the research is, not there yet, but I think at least including some basic information about maybe the different types of risks, given that they may be synthetically made and things like that. I think definitely at least some information which would allow the bud tenders to kind of provide basic ways to compare the substances, I think would be very helpful.
Thank you.
Member Garrett?
This was great information, and I see the need maybe for training and things. I was surprised on the 16 states and the background check. And do you have any more feedback on concerns or anything with the background checks of bud tenders and the ones that did dispute it? What was the results of those disputes? But was there much conversation around requiring background checks?
So in the manuscript, we have a detailed table of what the different types of background checks for each state entailed, what exactly they were looking for, and what would, disallow someone from applying. In the few states that did allow petitions, we didn't, look into results of those petitions, but I think I mentioned in the presentation, a few states were very vague about what would disallow, like, quote unquote, moral character and things like that. I think removing that would be fantastic. Making sure we have, a conform, comprehensive process across individuals. What that process is may look different, but at least having, something comprehensive written down so it would kind of decrease the variability between people.
Right. And I'm just curious as to whether or not that matters, being a state that was had our cannabis, I think the first state or the second state, that to my knowledge, and that's something I'll ask internal, there hasn't been any concerns regarding background checks on anyone bringing up if they had known this or known that, they would have never hired that person, that type of conversation. But I don't think we've had these type of conversations. On the states that are doing that and including background checks, are these states that's just new coming into the industry?
So
I
most
saw
most of
Oregon. Did see Oregon as one, and I
yeah, a
know
lot of
they've
them
been
did
in.
have, sorry to interrupt.
Okay.
A lot of them did have background checks. It was just a matter of like, did cannabis related felony exclusions in the past apply? So I would say that the majority, I think it was 16
Great,
um,
16.
had background checks. So most of them did have them.
Yeah. All right. Thank you.
Dr. Luperco, thanks so much. Agree with Member Garrett. It's really interesting, and this is something we've been chewing on for a while, so it's really timely for us. Couple of questions. Any sense of the places that require training, and then what sort of training? Is there any change in consumer behavior or violation notices or anything at that end of the process?
We do not have that information, and that's really necessary information to get. I think it would be really important to see if there are differences in these trainings, which trainings are maybe doing better, and what types of information are they including. We don't have that information yet, unfortunately, but we're gonna try to get it somehow.
One of the things that anytime you go into a store, you hear people talking to the bud tenders, and usually it's, they're telling them the difference between different strains, and who knows whether they're accurate about that or not. I don't know. Do you think that, is there a evidence-based training that could include both things like the testing regime, which I think is a great idea to explain to people how safe the product is, but also that sort of consumer news, what are different strains, what does indica mean, if anything, that sort of stuff, or does that then sort of go into advocacy as opposed to disinformation? What's your vision of what that conversation should include?
Yeah, I think that's a great question. I think it really does just depend on if you're giving scientific information or if you're giving more personal anecdotes. So like in states where health claims are not legal, like bud tenders are not allowed to provide certain health claims, sometimes the way they get away from that is by saying, I've heard, or like a person has told me this. And so I think being really clear about the types of information that bud tenders are allowed to provide, such as things that are in peer-reviewed science, things that we know to be true, would be important, and making sure that these personal anecdotes, he said, she said kind of thing is not the type of information that they're allowed to provide. But I think consumers will be having these questions about, what is the difference between indica versus sativa, if I smoke it versus I vape it. And there is information on that. So I think as long as we're, pulling from the right sources, there's definitely a lot of information that bud tenders can provide.
Yeah, that's great. A lot of what I hear from both consumers and from licensees is the new customer, somebody who hasn't tried it before, and they just start with, what should I get?
Right.
And so it seems to me the bud tender there's got quite a bit of influence in behavior and things.
Definitely.
I have a question for Sarah. Sarah, have we done or thought about doing a survey to all of the retailers with this question around their thoughts on bud tender training and topics that they feel could be helpful if there was some type of training?
Wow, you could not have teed me up any better. Um, we are actually in the midst of putting together a survey that covers exactly those topics that we
Great.
will hopefully be surveying or plan to be surveying out in the near future, asking for direct feedback about their interest in bud tender training, whether they've received training, what types of training they might be interested in, and what topics and would be helpful, and where they see themselves in the role of bud tenders.
Right. I think
and-
that would be great. Yeah.
So I appreciate that nice tee up. Uh, Speaking of surveys, Nick has been really working hard on this survey, and Nick, I want to make sure that you have the space for any questions or comments that you have.
Thanks, Sarah. Thanks, Dr. Laparco, for coming and talking today. I just had a lot of people have already asked really great questions, so I just have a couple more about training. I just wanted to know what you think the most important aspects would be to include in a training. And I know you kind of touched on this, but I'm also curious what you think would be good measures of success to measure how well that training's doing.
Yeah, that's a good question. I think a lot of people turn towards testing. I'm not sure that's the right answer. A lot of people kind of cram for the test, you know, and then they write the right answers or they Google things. I really think like one-on-one personal or like synchronous classes is difficult, but it probably ends up having the best success. And I think the literature shows that as well. If you kind of talk through these situations with another person and you kind of, you know, and enact different types of questions that consumers might receive, it's a lot better. And so these ways of testing may be a little more, I don't know, like applicable in the real world, I would say. Does that answer your question?
Yeah, let's see. So I am also wondering, what topics do you think are most important to cover in a bud tender training?
So I think the main thing that at least new consumers want to know are the different types of effects and the different ways that they can use it. And so if we're talking about edibles, making sure to talk about, you know, the delayed effects. Maybe if you're talking about vape versus combustible products, talking about the different types of risks, maybe potency concerns, things like that. So just making sure that there's information on modes of use, as well as maybe people want to know, like, is there a certain kind of testing for contaminants, heavy metals, pesticides, things like that. I think that would be important to include as well.
Great, thank you so much.
We're just about to have a couple more quick questions, if I may. Have you looked at all at what bud tenders do or don't do in the hemp-derived THC markets that have popped up around the country?
So yes and no. We have looked, because these hemp-derived products are not normally sold in licensed establishments. They're sold in like tobacco specialty stores, vape shops. We've done a lot of surveillance where we just call them and we ask, what are you selling? What is it? And most of them don't know. All they know is it gets you high, and that's pretty much all they know. And so, you know, there's obviously no training that we can, you know, enforce on people in those situations. But yeah, it looks like there's just a lot of misinformation out there regarding those substances.
Yeah, that's what I thought. And a good reason for the people within a licensed system like ours to have some kind of training. It's a distinction
Exactly.
that I think
Yeah.
is helpful. Boy, I certainly don't, as a regulator, don't want to be charged with deciding reputation and moral character of anybody.
Right.
That's incredibly vague, but I understand the need there. Do you, you know, you said you had concerns about testing just because, of course, you can cram, you can look up. Any sense of, you know, like, is there value in a certification process? Should it just be trainings made available, information made available? How important is it, sort of that official imprimatur of I'm a bud tender?
You know, I'm not sure I have the answer for that. I think having the information out there is fantastic. Whether we want like some sort of certification process, I think it would be important to at least have something showing that they did this training. Now, what the type of testing entails, I'm not sure I'm the best person to answer that.
Okay, thank you. Well, one of the things that after our survey, I talked to Sarah about, which is just I think the value in us as regulators trying to develop some relationship with bud tenders and retail people and sharing information. And we should send them this study and put that out
Yeah,
to people just as
absolutely.
another little data point. So any final questions, Member Garrett or Sarah, anybody? No.
No, I
Okay.
just want to say thank you so much again for your time and for your expertise.
Absolutely. Thank you for the opportunity.
Yeah, thank you very much, Doctor. Appreciate it. That was great. Okay, we will move on now to our second item, which is review and discussion of the Spokane Tribe of Indians Memorandum of Agreement. You can come up, sit up here. And our tribal liaison, Dr. Marla Conwell, will join me for that. This is something that will be presented to the board tomorrow.
Good morning, Chair Postman, members of the board and the audience. I'm happy to bring forward the new memorandum of agreement for the Spokane tribe. It includes the new clauses for the dispute resolution in it and has general updates as well. So this is actually the renewal of it, not a brand new one. So
Okay, great.
because of the changes, we wanted to bring it to the board.
And so it will come to us tomorrow for a vote.
Yes.
Just because normally we wouldn't.
Right,
Okay,
right.
got
But
it.
when there are substantial changes, we do want to bring it forward.
Okay, great. Any questions on this, Member Garrett? No. Okay, thank you. I did mention this tomorrow, but I will to everyone else too. I was at a tribal conference the other day and ran into someone from the Spokaneans who just couldn't say enough great things about working with you on this and trying to get through the sticky stuff. So appreciate hearing that. It's always nice to hear the
Thank
good
you.
things when we're out on the road. So thank you, and we'll see you tomorrow.
Yeah, I sat with their chairman at the Centennial Accord.
Oh, good.
meeting.
Oh, great.
Yeah.
Good.
Thank
Okay. Okay, now we will move to policy and rules team updates and prep for tomorrow's board meeting. And our external affairs director, Justin Nordhorn, is going to take us through the first of this.
All right, good morning, Chair Postman, Member Garrett. We've got a few items for tomorrow. I wanted to cover rule petitions that we'll be presenting tomorrow. This is that we received 5 rule petitions essentially on the same topic, which is a request to repeal a couple sections of rule associated with title certificate holders in the social equity and cannabis program. And pretty much all 5 had the same request for the same 2 subsections to be repealed. And as we look at these, the issues around this, we already have the rules open and open for discussion. So our recommendation tomorrow will be to deny the petitions. However, I will cover some of the considerations that are currently underway that actually are associated with the petition. So it doesn't make sense to open or to accept a rule petition to open rules that are already open. And so we are actually moving in this particular project to file a supplemental CR 102 based on the public comments that we received. And so there's still more consideration to be done. And so we are not going to be presenting a CR 103 in the near future, but we'll be fine tuning and having some more discussions around the social equity and cannabis program. And so this will all be a part of those discussions as well. So just because we are as staff recommending denial does not mean that we're not going to be discussing the impacts of title certificate holders in the assessment analysis.
So on a supplemental, that is one of the things we could look at, what happens with title certificate holders, right?
Yes.
Can you talk about what else is it too soon to know what staff might be bringing forward in that supplemental?
So what I can share is that, so the supplemental CR 102 is any substantive changes from the original CR 102. So if we have those substantive changes, we have to go back and start the time period over and present a new draft. Within that, some of the considerations that we're looking at is around the title certificate holder topic. We're also looking at the mobility, if you will, topic, even though mobility is sometimes misleading because it's the initial siting of the location, not actually picking up and moving your location. But that will be part of the discussion. The rubric, there were several points that were made publicly that we're considering under the rubric. And so I think we also probably will provide a little bit more detail. I don't know if it'll be in the rules, but why we had some of the rubric scores where they landed. And we heard from stakeholders, so we're likely to adjust a number of provisions there. But for example, the household income issue, we heard definitely loud and clear from stakeholders on what their opinion was on that. So we are reviewing that. But the impact of the household income is only for the year prior to applying. And so it doesn't have as direct of an impact as, say, your incarceration or living in the DIA, because this is only for, and if we open the rules up, or I'm sorry, if we open the licensing process up in 2025, you're talking about 2024 is the year of assessment for that. So hopefully we can build some understanding about why those were weighted in that particular method. But those are all points that we're considering right now. We have several meetings coming up, and we'll have more to share as things progress.
Garrett?
Justin, a couple of questions on the certificate holder. To my knowledge, I thought first of all, the certificate holder has to qualify as a social equity applicant. And in doing that and looking at that, I thought that this only is maybe 2 or 3 that, or if that.
Yeah, my understanding is last time I heard from licensing, when they looked at the 2870 applicants, there would be about 5 that would have qualified for, who would have qualified as a social equity applicant out of the title certificate holders. And yeah, it's a trickier one because, if you're a title certificate holder and folks are trying to bring on social equity or qualified social equity applicants for representation, they would actually have to give up the majority ownership of that business, because you have to be 51% social equity ownership. And so there's, I don't know how many people are going to be willing to give that up, but we're hearing from folks that they're concerned about that. And so when we're looking at, it's in the statute, that's one of the challenges. It's not very specific in the statute, which is not a challenge, but so we really have to evaluate what that looks like and how it's categorized, because the statute appears to be describing title certificate holders in a different manner than social equity licenses and applicants. And so we're trying to figure out, okay, how is that distinction and what does that mean in the deliberations moving forward, and what should or should not be considered. And so these things are under consideration right now because, of course, we want to do this right. We don't want it to be fast and have some gap. So we are providing due consideration, even though our recommendation is not to open a rule that's already open.
And also on that point, the statute is a little vague about what's titled, but also it seems to me we should be able to say you're either going to be considered part of social equity with all those restrictions and benefits, or not. You can stay where you are, right? You can't say we want some of those benefits of the social equity program, say like mobility, but also want to be able to sell our license in a year.
Yeah,
social equity applicant couldn't do that.
Yeah, there's a few different parameters, but let's if and again, this is all still under analysis at this point. But if the title certificate holder is viewed as a different definite, or is defined differently than the social equity applicant, if they're a title certificate holder who meets social equity qualifications, that may mean that they don't go through the licensing process. But that also means that they're not an applicant because they've already applied and they've already been issued. And so some of those privileges may not carry back and forth. So yeah, if you're a social equity applicant and license, you're not able to sell your business for a year, and then you can only sell it to another social equity applicant within 5 years. And that's not something that would be confined with those title certificate holders. However, with the title certificate holder, it may be more limited mobility because they are not an applicant. But there may be some opportunities. And so we're really trying to balance what does that look like, and how, we certainly want to look at the impacts, ramifications, and fairness of all of the issues that we're pulling forward. So those are some of the considerations that we're evaluating right now.
Okay.
So are you saying, in other words, that it's possible with the title certificate holder, there is not a gain for them to be a social equity applicant? It can actually take away, or it's a matter of when, whatever that is?
Yeah, it's difficult to really pinpoint that. So when I think about the 51% ownership, you could still bring on multiple applicants who collectively would meet the 51% ownership. However, it may not be, as an individual, they may not be in a majority ownership of any part of the business. And so, it doesn't mean that somebody would give up full control of a title certificate, because there could be other combinations that may not lead to that. However, as the cumulative whole of 51%, there would have to be some sort of a shift in ownership of that title certificate. And so, there's a lot of different layers of complexity that we have to think through and figure out what does this mean and what does this look like. And we understand the petitioner's concerns. And again, we're thinking about those as the deliberations continue. So hopefully, I don't know if I answered your question specifically, but
I'm setting aside the petition, but just on the subject period, is it a matter of, even with the petitioners, have we explained this general for people to understand that? Is it more understanding than it is we don't want title certificates?
Yeah, I think there is likely confusion, and
Right.
and more understanding would be beneficial.
Right.
And I think with what we're trying to explore right now, we should be able to come out and really pinpoint this is what the impact would look like. Because I think the concern is there's 40 plus title certificate holders, and they're all going to be competing against applicants, and that's not
Right.
necessarily the case. And like I said,
Right.
the last evaluation we did, there were 5 that may have qualified. So
But I think it's also what you said about, again, the statute being somewhat vague. I think we have to be really careful and put in the, sidebars for where we think it should be. Because because of that vagueness, I understand people's concern.
Yep.
It's not exactly clear, but I think we can get there. I also think that, and we need a better word than mobility. I don't know what site selection, but anyhow, is important too. And I heard that feedback really clearly. And I think you and I have talked about it a little bit, but just to be clear, from my perspective, I think what we want to avoid there is somebody who applied in a small county where maybe there was, 1 applicant and they scored 200 points. They shouldn't be able to move to King County where the minimum score for qualifying was maybe 300 points. Like, that's not fair.
Yeah,
and I know the 2870 is set up different. 2070 are set up differently, and we want to merge them at some point. That makes sense, but not right out of the gate, it seems. I think we're going to have a crash there.
Yeah, I think one of the other, and I know people don't want to go through a process. Nobody does.
Right.
So,
I don't.
But nothing prevents anybody from 2870 or former title certificate holders from applying under the 5080 program. So there's always going to be an opportunity for them to apply and, have the evaluation done under the newest statute that was updated. So
you could have a title certificate and then make a whole new application for a social equity license and
Yeah.
potentially have 2 licenses.
Correct. It won't take away from
Couldn't
anything
stop
that you previously applied or
Right.
hold. It's just you can apply under
Like a
58.
2870 person can get a license in 2870 and in 5080.
Yeah, there's nothing restricting that
Yeah.
application.
Yeah.
So we do have during each window that there's only one application per entity. But that doesn't mean that if you had applied before, that prevents you from applying again.
Right. Okay. Last question on that. Any sense of timing?
I'm hoping that it won't be more than, so we were planning on doing the CR 103 tomorrow. So I'm hoping it won't be more than a month delay. Because we need to make sure that we're having these conversations and being able to draft up the rules and then of course, do final reviews and whatnot. And so I think 2 weeks might be a little bit tight, to be able to get everything completed to you all for review as well and that sort of thing. So I'm planning on, probably not the next board meeting, but the second one in October is what I'm hopeful
Okay.
that we may be able to pull something together. Because we're not rewriting all of the rules.
Right.
So I mean, this is an update. But we certainly want to build in that time to be able to complete it appropriately. So I don't see this impacting anything else in the social equity and cannabis program. This shouldn't create delays for any of the work going on, let's say with the RFP or
For our third-party vendor.
correct, or with the licensing approach for 2025. I don't see this creating a delay anywhere else. So I think we're in a good spot to be able to take a pause, make sure we're considering all of the stakeholder feedback, and see what we can do to try to meet multiple interest points.
Does the board have to take action tomorrow to not approve the 102? or
No,
to-
so
to
what
put a
we'll,
supplemental?
what we'll likely do is, we need to come back to the board, it will not be tomorrow,
Okay.
to present a supplemental CR 102. So it's just
I
like,
see. Okay.
and so actually the month delay is getting something back in front of the board. Then there will be a 30-day public comment period again and another public hearing. And so there's going to be more process in this. So, it could be a 4 to 6 week delay total. But I think that's worthwhile to consider everything that we heard.
Yeah, absolutely. And I would just say that if we get to that point where, since we only meet every other week, if
Yeah.
you're ready in between, let us know. We can do a meeting.
Okay.
So if it, we don't have to have 2-week break every time. So keep that in mind. So,
Okay.
okay. Any other questions for Justin? No? Okay, great. Is that your items?
The other thing I wanted to provide an update on, because there was a change for tomorrow. So we were initially planning on presenting the CR 103 on the THC rulemaking implementation. And we are holding that for 2 weeks. We have to fine tune some issues that came up, quite frankly, late last week. And it was a really good catch because people weren't really thinking about it. But just to give the nutshell version, the original timing of 2 rule projects was going to be completed first, and then the cannabis medical endorsement rule package was going to be completed just after. So that one had changes to 080 in it. This one has changes to 080 in it. We have to take out the changes of 080 in this one, or else we nullify that entire rule project before. So we're working with the code revisor's office to make sure that we're doing this right so that we don't inadvertently, wipe out a former rule project. And so we had to say, okay, pause.
It's not a substantive
No,
change.
this isn't a
You don't
substantive
have to do a
change.
Supplemental.
Correct. Yeah,
Okay.
yeah. But we need to make sure that gets right so we don't compromise the other rule project. Yeah.
Okay. Great. Anything else?
I think that's it, unless there's other questions. I'll turn it over to the other rules coordinators that are presenting
Okay.
tomorrow.
I think Daniel Jacobs is next on our list. Cannabis payment flexibility.
Good morning, Chair Postman, Member Garrett. I'm here this morning to preview the final rules that I'll be requesting approval of during tomorrow's board meeting on cannabis payment flexibility. If the CR 103 is approved tomorrow, the final rules will be filed the same day and effective October 26th. This project is amending WAC 314.55.115 on what methods cannabis licensees can use to purchase cannabis from other licensees, and is the result of a petition that the board accepted in March 2023. The CR 101 was filed May 8th, and a survey with draft rule language was posted on the LCB website from June 3rd through July 8th. The survey results indicate that the licensees who responded were generally supportive of the proposed rule changes. The CR 102 was filed July 31st, and the public hearing was held September 11th. 314.55.115 identifies check, prepaid accounts, debit or credit card, electronic funds transfer, and using a money transmitter as methods that licensees can use to purchase cannabis from other licensees. The final rule changes clarify that, just as with the other payment methods, the purchase order has to be done by an irrevocable invoice. Both parties have to keep records consistent with other LCB requirements, including relevant proof of mailing, and the check has to be mailed no later than the next business day after cannabis delivery, and it has to be deposited no more than 5 business days post-cannabis delivery. We only received one comment on the CR 101, asking about issues related to insufficient fund checks. 314.55.115 already addresses NSF or insufficient fund payments in Section 6, saying that NSF issues have to be corrected by 3 p.m. on the business day after the NSF issue is reported. Otherwise, it becomes an impermissible extension of credit. Prior to and during the public hearing, we received one comment and testimony on behalf of WACA, which requested removing the deposit deadline entirely. Removing the deposit deadline would create an inconsistency with other payment methods in the rule, all of which have a defined endpoint, and we strive in our rulemaking not to make internal inconsistencies. We've clarified that keeping records of financial transactions includes relevant proof of mailing when you're mailing checks, and the form of that proof is up to the licensee. While proof of mailing isn't explicitly required for the other payment methods don't involve the use of mail, so the proof of mailing isn't as relevant to them. Lastly, in response to some concerns about how the 5-day deadline is going to be enforced, we'll be conducting a retrospective review in October 2025 to examine corrective actions that arise from this rule. And we'll be examining the results of that review during a public board meeting or caucus to determine whether these rule changes that we're doing lead to the increase in corrective actions. Thank you, and I'm happy to answer any questions.
That's great. What is that review a standard procedure, or is that something in particular we put in this one because of those questions?
So it's something that the RCW says, the RCW on implementing rules says that the agencies should always sort of examine the impact of rule changes on their licensees. And so we always talk about how generally we're going to do that. But I wanted to sort of, this one that we're specifically committing to say we're going to do a retrospective review a year from implementation, this is a little unique. And in part, that's because of the concerns raised about the sort of 5-day check deposit deadline. And, you know, yeah.
Okay, great, good. I'm really glad we're doing it and said it. Any other questions for Mr. Jacobs on this? No. Okay, thank you. We'll see you tomorrow.
No problem. And I did just want to actually give one quick rulemaking update on a totally different rulemaking project. Next week, we're having stakeholder engagement sessions on our emergency liquor permit rulemaking. We have the draft rule language up on the website. A Gov delivery message went out. But just for anyone who's watching and didn't get that, those sessions are going to be on Monday, September 30th from 10 to noon, and Thursday, October 3rd from 1 to 3 p.m. They're both going to cover the exact same material. So you're free to attend both, but if you can only make one of them, that's fine too.
Okay, great. Thank you for that.
Thanks so much.
Okay, that brings us to the end, which is just board member and executive assistant reports. Gretchen?
Nothing today, Chair Postman. Thank you.
Thank you. Member Garrett, anything today? I just want to I have a quick correction. I said that I think I said member Vollendorf had a conflict and was on leave. No, he has a conflict, so he's not on leave. He's got an official conflict, one or the other. So anyhow, just in case anybody else was chewing on that like I was throughout the whole meeting. Okay, with that, we will adjourn and we'll be back tomorrow morning at 10 for a packed board meeting. Thanks, everybody.